What is going on, busy bariatrics? If you're considering surgery, one of the first questions you probably have is, how much weight will I lose and how fast? Let's set some real expectations. I'm going to give you some numbers, a timeline, and factors that usually matter the most in your bariatric journey. On average, most patients lose 50 to 70% of their excess body weight within 1 to 2 years. That means if you're 100 pounds over your goal weight, you could expect to lose 50 to 70 pounds in that first stretch. Sleeve patients usually lose 50 to 60%. Bypass patients often lose a little more and are closer to 60 to 70%. Again, though, these are averages, not guarantees, and that's going to be very important to remember. In your first 3 months, that is where you're going to see the drop be the fastest. It's going to come from a combination of water weight, rapid fat loss, and the sudden change in intake, all adding up and culminating. Months 3 to 12, you'll see steady losses, but it does slow down compared to those first few months as you begin to eat more food. After the first year, weight loss traditionally tapers, and by year 2, most people are in maintenance. That's when the real work starts because you have to build the habits to keep the results, and you need to really start that within the first year after bariatric surgery. Your numbers will depend on more than just the procedure. Other considerations are your age, your metabolism, health conditions, medications, and genetics. But here's the biggest factor. How consistent can you be after bariatric surgery? I have found from coaching hundreds of bariatric patients that the patients who track their food, hit their protein, and strength train regularly see the biggest long-term results. Surgery gives you the tool, but what you do with it is actually going to determine how far it takes you. Other things to remember is you don't want to get caught up in comparing your journey to someone else's. 2 people can have the same surgery, be the same height, the same weight, and the same age, and still lose at different speeds. What matters isn't necessarily the pace. What matters is staying committed when the pace actually changes. And that's going to play a big part in your results. So if you're wondering how much you'll lose and how fast, I want you to remember this. Most patients lose 50 to 70% of their excess weight in 1 to 2 years. The real success comes from what you do every day after that. If this helps set your expectations, subscribe, check out the full top 10 playlist, and let's keep getting busy.